Falls by the elderly are very common, but many falls can be prevented. Hi, I'm Kathy Getrist, and I'm an instructor in community health. And today's topic of discussion is going to be about fall prevention and alternatives to the use of restraints. Currently, falls are the leading cause of death, illness, and injury in healthcare facilities. More than half of all residents in a nursing home fall on an annual basis. In a hospital setting, 10% of older people who have fallen die before their discharge. 1 in every 5 falls ends in death of persons that are 85 years of age or older. If not death, falls oftentimes will cause a downward spiral. I'm sure many of you might have an example of a grandparent who has sustained a hip fracture, for example, following a fall, and the course following that episode ended up with their death or disability in a nursing home. The statistics that I've just reported may change, but the harmful effects of falls remain constant. Falls are bad for everybody, not just for the resident. A person who has fallen and sustained some injury makes your staff, you and the rest of the staff's job harder, and can even lead to legal action in the form of a lawsuit against your facility. Falls increased health care and insurance costs as well. In the United States, the total cost of falls is estimated to be well over $100 billion, with a B, dollars per year. But let's look on a more positive note about falls. By preventing falls, you can help the resident maintain the best possible physical and emotional health. Well, why do falls occur in the first place? There are 2 main factors. The first factor is the resident themselves. Many conditions, disabilities, and medications can contribute to a fall. The mnemonic, "I hate falling," that you have there in your student manual identifies the key reasons why a resident will fall. First, inflammation of the joints. Someone who has rheumatoid arthritis, has swollen, painful joints, is much more susceptible to falls than others that don't have that. Hypotension, which is low blood pressure, causes sometimes people to become lightheaded and can fall as a result of that. Auditory and visual abnormalities can be problems with hearing. Someone can be working behind an individual, maybe because they have hearing loss, they aren't aware of them. They turn around, become startled, and as a result fall from being startled. Tremors, another reason why a resident might fall. Tremors are the shakiness that you see with people with Parkinson's disease and other problems, much more susceptible to falling with that. Equilibrium problems is another reason why people fall. An inability to sense their balance, and they are frequently fall candidates. People with foot problems. For example, if someone has numbness or tingling due to nerve damage, could be from multiple sclerosis, for example, it's very difficult to even know where the floor is and where your feet are when they're numb. Arrhythmias or other heart problems can cause problems with lightheadedness and dizziness. Leg length discrepancies. That simply means one leg being longer than the other, causing a limp, and that precipitates falls many times. A lack of conditioning. Many of these folks do not participate in any kind of a regular exercise program, so their muscles are weak and they're frail and much more susceptible. Illness, for example, diabetes, a chronic disease that sometimes causes hypoglycemia or low blood sugar. When someone has an episode of low blood sugar, they have disorientation and dizziness that certainly can be a factor in their falling. Nutrition problems. When people are not eating well, they're malnourished, their muscles become much more weak, and bones are brittle because of loss of calcium, and very possibly could fall. And the last are gait difficulties. Gait simply means whether you're walking, skipping, hopping, and such. Their walking becomes much more difficult if they've had paralysis on one side of their body, for example, from a stroke. In addition to the resident being a factor, having falls, the environment is the other factor. Most falls don't just happen. There is a precipitating trigger that causes an accident. I'd like to talk with you about some of the common triggers in the environment. The first are ill-fitting shoes, or shoes that have just been slipped on, maybe in haste and the laces have not been tied, or someone that has floppy slippers and maybe shiny soles that don't have a good grip, certainly predisposes a person to fall. Poor lighting, both during the day and at night, can cause falls. Slippery floors, another thing. Not only floors that might have water on them or snow that's been brought in from outside, but also highly waxed floors can cause patients to fall. Medications that are associated with sedation or lowering blood pressure can be a factor. And personal items that are not within reach. Sometimes the phone will start ringing, the patient is in bed, and the phone is too far away for them to reach. They really want to get that phone call, and will stretch more than they should and very possibly fall in an effort to try to obtain that or any other item that's out of their reach. Restraining a resident is not the answer in these situations for patients that are fall candidates. There are lots of other interventions that can be tried. If you recall, restraints would be the very last resort. These other strategies are much more appropriate and available, and I would like to cover some of those strategies with you, but bear in mind there are many, many others. Always leave the bed in lowest position when you are finished with your care. Adjust any protruding objects like bed wheels or a bed gatch handle so that the resident doesn't get up from the bed and accidentally knock into them. Keep the pathways free of any clutter from any equipment that might